Patients with a motor impairing disease will be the primary demographic for this IoT solution. To help provide these patients with an increase in mobility and independence while still ensuring their safety, an IoT system will need to be applied. The IoT system will be created based on eye gaze technology, in which the system is able to track a patient's eye movements by reflecting infrared light off the eye. This IR sensor will be used to collect data on a patient's eye movements by monitoring the infrared light reflecting off the eye. This data will be used to control the movements of the patient's wheelchair. A proximity sensor will be implemented into the patient's wheelchair to allow the chair to prevent the patient from colliding into a nearby obstacle. A wearable device will be used to monitor a patient's pulse rate, peripheral perfusion index, and oxygen saturation. If the device identifies that the patient requires immediate medical attention, the GPS position sensor will send the patient's current location directly to their list of supporters.
Through the use of our iWheelchair app and its few devices, the disabled patient would be able to move through the use of the eye tracking glasses, infrared sensor, pulse oximeter device, and connected wheelchair. The patient would only need minimal support in moving, whether they can use their arms or legs. The only necessary help would be for being placed into the wheelchair, placing and setting up the app and device. Supporters of the patient can also use the app to check the current health status of the user and find other useful information. The pulse oximeter device also checks the patient of their heart rate, peripheral oxygen saturation, and perfusion index, and record the current health status of the patient. If the pulse oximeter gets an abnormal reading on any of the three health statuses, an emergency notification will be sent to the patient's supporters and will also notify them of the patient's current location. Once the patient has logged into their account, they can choose to access either their health records or their list of supporters. If the patient chooses to access their health records, they can select one of the listed options to observe the documented data retrieved from the IoT device. If the patient chooses to access their contacts, they can view, add, or remove supporters that are listed.
There are 3 types of supporter accounts. These include the caretaker account, family member account, or medical support account. Once a supporter account has logged into their account, they can choose to access the linked patient's current health status, current location, or health records.
If the supporter chooses to access the patient's current health status, they can select one of the listed options to observe the current data retrieved from the IoT device. The above screenshots display the device retrieving data, while the below screenshots display the device unable to retrieve the data.
If the supporter chooses to access the patient's health records, they can select one of the listed options to observe the documented data retrieved from the IoT device.
If the supporter chooses to access the patient's current location, they select the location button to view the patient's location and current health if they require medical attention. If they require medical attention, a notification will be sent to the supporter's mobile device. If the patient doesn't require medical attention, the patient's current location will not be displayed. There is already an electric wheelchair design where the patient uses a joystick to control the movement of the wheelchair itself. The idea of tracking the eye movement of a person has already been used in other functions and areas, most generally in human-computer interaction. For the iWheelchair app, we manipulated or interpreted that idea for a more hospitable and mobility interaction, which for this app is for disabled patients who aren't capable of using their arms or legs.